Well, hello and welcome. You're watching India Fights Back with your host, Rajat Kane. Well, in this episode, we'll take a look at the need and, of course, the reasons and pace at which vaccination drive has to be ramped up as India continues to see surge in COVID-19 numbers. Well, in last month to say off, we have seen numbers rising dramatically after it had hit an all-time low during February. At the same time, governments, be it the state government or at the center, they're all trying to confront and, of course, address the issue of increase in numbers. Among the things that has been suggested by the governments as well as the experts, of course, is COVID appropriate behavior and also vaccination. Well, in this episode, we'll take a look at vaccination drive and what all it needs to ramp it up. We are joined with Professor Narendra Kumar Arora, Chairman COVID-19 Working Group. So many thanks for joining us, and Dr. B.L. Sherwal, Director, Rajiv Gandhi Super Speciality Hospital, Delhi. Many thanks for joining us, Dr. Sherwal. Let me start with you, Dr. Sherwal. In Delhi, we have started 24 hours vaccination. What do you think is the reason behind it and how it will help in, of course, addressing the issue that has come with increase in numbers of COVID-19 positive cases in the capital?
Yeah, Mr. Rajit, clear. Because the government has assessed the need of vaccination,
Right.
and it has also assessed the number of cases which are rising not only in Delhi but also other part of the country. So that is why government has decided to, first thing which was done is to increase the session site. In each institution, we are running around 5 to 6 session sites so that more and more people can come.
Right.
Then in the second phase, the government had decided to increase the timing from 9 a.m. in the morning to 9 p.m. And now it has come, 24 hour. So that, it has been observed there are certain people who are not able to come to the hospital or vaccination session site because of the duty hours or long duty hours. So that is why to give them the facility for getting themselves vaccinated, I think this is going to be a game changer for success of the vaccination in the capital. And what as a scientist we talk about the herd immunity actually, and it is going to help in a big way for
Okay.
attaining the herd immunity if more and more people can get vaccinated in a limited time period. I think that is the motto, and government is really eager to have the response of the people, that how many people turn out in the evening and in the night. From today onward, I think we are in some places we have made it functional, and from tomorrow we will be able to do more and more site today the aim of all the district is taking the meeting, and the work is on, and I'm quite hopeful that this will really be of great use.
Right, right. Absolutely. Many thanks, Dr. Sherwal, for opening remarks. Let me have here Professor Narendra Kumar Arora, Chairman COVID-19 Working Group. So many thanks for joining us. Sir, your opening remarks, especially, of course, we have seen a surge in cases. How serious is situation? And of course, besides COVID appropriate behavior, which has been stressed upon by all the experts, what else would you think is absolutely must at this stage?
So I think last year, one of the important reasons why we were able to fight back very effectively, because there was a overall community engagement. We did not go out without reasons. So that social distancing was being maintained. We were very particular about using masks. did not attend, or there were no social gatherings. So all
Right.
these were very much in place,
Mm-hmm.
and it was because of the inherent fear we had and everybody had at that time. I think over the time, uh, people have realized that this disease is particularly mild in young people. They get a flu like or a common cold like illness and they become all right. Most of the times, nothing happens. And the serious illness and the elders who are have to be go to ICU or have fatal outcomes,
Mm-hmm.
not everybody understands the significance because they have not seen in their family. So the fear has gone, and I think that has brought in a callousness and a
Okay.
carelessness
Mm-hmm.
and complacency that people have not followed the COVID appropriate behavior.
All right.
And finally, when we talk about the from January 16th onward, the vaccination program, it has started, and we thought that panacea has arrived, but that's not the issue. The reason
Mm-hmm.
is that vaccine reduces the symptomatic illness.
Mm-hmm.
It reduces or practically eliminates severe disease or death, but it does not prevent infection. So all of us are now hearing that I got the vaccine, I have got become corona positive or so and so in our acquaintances, which is not surprising because none of the available vaccines anywhere in the world, including the two vaccines we have, prevents infection. It reduces the
Okay.
symptoms, it
Mm-hmm.
prevents severe disease. So
Mm.
the vaccination is only a part of the package of the overall COVID appropriate behavior. In
Right.
isolation, it has no meaning. And
Okay.
so, this demand of expanding the age group
Mm-hmm.
probably looks out of place. I think the
Okay.
first issue is that we should immunize those people who are likely to die or who are likely to have severe illness, hospitalization. So, all
Mm-hmm.
those who are above 45 years, irrespective of their illness and other morbidity status, because 90% of deaths and hospitalization occur in this age group. And
Right.
this 45 and above by itself takes about 30% of Indian population, 40 crore ho jate hain. And
Mm-hmm.
if unless they are immunized, I think the effort will not be as effective as we envisage it to be.
Hmm. So, Professor Arora, as you said, we have to look at vaccination from a point of view of the entire package of following COVID-appropriate behavior. At the same time, you remarked that there is a complacency. How long do you think we can really blame people for complacency? Because post the unlocking, they continued with the jobs and other social gatherings and things, and that has to go on. So, is there a way out besides continuing life as normal, at the same time maintaining all the appropriate behavior so as to stave off COVID? Or we have to go for some restrictions of sorts?
So I think this is absolutely wonderful. We are also tired. We cannot be all bound. Economy has to get back. Social system has to go back. But the only request simultaneously is that we use mask. Mask is the most important thing component which prevents spread of infection, because infection is in droplet form, airborne from each other. And if we have the mask, this is the most effective way. To
Right.
the extent possible, social distancing should be maintained. But
Mm-hmm.
in a crowded area, in a market, and other places, it may or may not be possible. But the third thing, frequent washing your hands and ensuring that you don't touch things lying on surrounding you, and then etc. These are important issues. So, and we can continue our normal work. So,
Right.
vaccination is only one component. That is what I am trying to say. But if we do not have mask at least and frequent hand washing, it will not be possible to really contain the problem.
Hmm.
And rest of the life can continue as such. And this
Right.
also means that mask has to become part of our cultural behavior, almost
Okay.
like that.
Right, right. Many thanks, Professor Arora. I'll just come back to you. So, Dr. Sherwal, you agree that really we have to balance it out, our priorities in terms of first, of course, safety first. That's really important, so as to you cut out any possibility of having ourselves infected. At the same time, of course, there is a fatigue with the disease and pandemic in general, and we want to get back to our normal social lives. At the same time, work, and there are economic issues involved into it. So.
Definitely, as Dr. Arora had very beautifully explained, basically, that life has to move on. And now, as we have seen that there are waves, one after the other, we have seen in Delhi particularly, we say it is a fourth wave. So it is bound to happen. The COVID, even after this, once it gets shattered, it may come back. So now we have to basically start living with COVID. So everyone has to take, now we know that how this disease spread from one person to another person. So, and that is a simple way that we can use the mask. But the only problem, we are using mask, and the most of the people in the, when you see in the market or on the road, most of them are not really wearing the proper mask. One,
Okay.
or if they are not covering the nose, then there is no use of wearing that mask, and only it is down to chin. So basically, it is to avoid the challan by police. It is not to safeguard their interest or the community interest. So that awareness, I think somehow complacency is there, and people are overconfident. So that has to be back. That please, the mask is part and parcel of our lifestyle. We should wear mask in whenever we are meeting people, and it should be properly worn. So that should be a compulsory. Otherwise, rest of the things now, I agree that we cannot lock people for so many days together, and economy and all other means are there. Even the doctors are fed up treating the patients of COVID. So they also want that we want to have non-COVID activity also in the hospital, which I am facing the challenge that now our
Right.
doctor colleagues are also wanting that non-COVID activities should also be run parallelly. So that is why we have to learn to live with COVID, and whether it is hospital or home or community level, I think this is the only way we have to live with it.
Right, right.
Quite simple.
Yeah, Dr. Sherwal, but just before I go off to Professor Arora here, in your last reply, you were talking about a certain threshold of, say, herd immunity that you're targeting. What is that? And perhaps, are you seeing that target of herd immunity of a certain threshold, which has been earmarked, is achievable in a shortest possible time, or will it take a bit of time to come?
So it is always better to take, this is always like this, that more and more people get infected, whether it is asymptomatic or symptomatic, or more and more people get vaccination. So when they combine together, basically, if around more than 50, 60% people have developed the antibodies, so that means to some extent it has already been there in the community, and that is known as herd immunity. And you have seen in Delhi or in other part of the country, when the Zero survey was done, the
Right.
highest peak was there in the November, and then after 2 and 2.5 months, the Zero surveillance was done. So at that time in Delhi, 56% people were having antibodies. So that was really a sort of herd immunity, and because of that, we have seen decline in number of cases, and we were presuming that now COVID is gone. So we are expecting the same way that this time, if we do the zero surveillance, we should get more than 60% people are
Right.
zero positive. And I'm hopeful that if we'll be doing the zero surveillance after say 15 days or so. I'm quite hopeful that we will be able to get the herd immunity, and the curve will moving toward the flattening.
Right, right, right. Professor Arora, there were two studies that were published, or to say reported last week. One was about, there was a study conducted by scientists and experts from IIT and IISCs about the surge in numbers. It will be reaching its peak around, say, third week of April. There was another study by ICMR which talked about reinfection. Now, as an expert, sir, my question here is to you, is there a possibility of reinfection among people who have already been treated or who have healed up from COVID-19 infection in last, say, 3 to 4 months, given the surge we are seeing?
So, reinfection is an issue which has been raised right from the beginning last year, February. And it is not such a huge problem. Many times it looks like that it is looming. When mutants have come, the possibility of reinfection has increased. That there may be some viral strains that may reinfect the individual because the immunity generated by the previous infection may not be sufficient or may not be appropriate for a new infection. So that's a possibility, but still overall reinfection is going to be rare, uncommon, far and few. So that should not be so much of a problem. If somebody has got infected, I think person can be reasonably comfortable that it will not occur. And actually, if you fall in the priority, you should immediately get yourself immunized because vaccine dose works like a booster. So if my antibody level is X, one booster sometimes makes it 10x or 100x also. Now that makes you protected for a long period. So even if the antibodies are weak, but if there are, then the risk of another infection or persistence of immunity remains for much longer time. So it is always good that if you are infected, get the vaccine. It will help you. It will be better effective, more effective in you as compared to those who are not infected.
Right. So there we have Professor Narendra Kumar Arora elucidating on this extremely important aspect of studies that were conducted about the surge in numbers, when it will hit the peak. At the same time, a study that was conducted by ICMR in terms of reinfection. Dr. B.L. Sherwal continues with us. Sir, your opinion, how important is it to study this phenomenon, or to say the correlation between the rising numbers? Of course, like as per the latest study that was done by IIT, we'll be hitting the peak of this wave in a couple of weeks' time. At the same time, there is, let's say, threat, or for that matter, chances of reinfection. How important is it to understand this?
These are two different things actually. Chance of reinfection and touching the peak of the spike.
Surge,
We all are expecting that now the number of cases which has touched a new height in India. It has crossed the mark of 1 lakh. So that is really alarming, and we hope that within another 2-3 week, which can be very rightly said that third week of April should be the end of this week, and it should start coming down again. So we are expecting that this should last not more than 2 months in total. So once it start going down by the mid of May, it should really come down, and by May I think it should be settled, flattened actually, as we are expecting this. And it was basically seeing the earlier trend. We were expecting that this to happen in April and May, and it happened like that only. Because if we see the previous cases also, and seeing the Western countries, so we were running 5 to 6 months behind to them. So it was expected that the next peak will be hitting somewhere in April and May. So that
Right,
was like
right,
this. And reinfection, as Dr. Arora has also stressed,
right.
yes, reinfection is not that common. Reinfection can be there, and only it usually said that it's usually mild, and it can be because of the various different strains, and sometimes it can be reinfection because of the same strain. So that is not that unusual. It can be there as in the other viral infection also. The infection can be there, so there is nothing to worry. And because, but it is not that common that everybody will get reinfected.
Right, right. Dr. Sherwal, just before we leave, sir, just a very small reaction of yours in terms of what we have done, like for you as say the state government steps, and if you look at the holistic picture of what India has done in terms of addressing this issue, and of course, like comparing it to the the Western countries. What would you say, like how far we have done or how good we have done in terms of controlling this disease?
No, actually, this is a new disease. You all know that, and we are learning, with the experience of other countries also, and our own past, that is 2020 experience. And this time, we are, having a little different strategy as compared to the last year when we
Right.
applied the common, the lockdown all over. This is not possible in the current situation because as the other things are also important. So with the COVID, actually, if we start living with COVID, and like there are important things, we all are saying that if there are really something important, like marriages of some of the families has been postponed last year, and now they were planning to have in April, which is the peak season. I think that is important family get together. But at the same time, we will request that you know. It should be done, and minimum people should be invited, and
Right.
only the required people should be there. And I'll request all the parents who are marrying their daughter or sons that they should write on the card that to have the appropriate COVID behavior while they
Right.
are attending the marriage. So
Well,
that
that
is
is.
through TV I would request.
No, absolutely. This is certainly a very novel suggestion, sir. And of course, like we hope that all the residents of Delhi and outside Delhi as well across India would pay heed to such suggestions by experts. Well, many thanks, Dr. Sherwal, for joining us, and of course, like throwing light upon this important aspect. Many thanks, Professor Narendra Kumar Arora as well, Chairman COVID-19 Working Group. Well, before we leave, here is a small appeal by all to all our viewers. Please keep maintaining your COVID appropriate behavior, keep wearing a face mask, keep washing your hands, and do not forget to maintain physical distancing. Remember, these are small things that help us in defeating this pandemic. Well, that's it in this edition of India Fights Back. Thank you. Goodbye.